Hi, this is Dorothy Preston from Best Friends Pet Clinic, and I'm talking with you today about cat vaccinations. A lot goes into vaccines, and there's a lot of research about it. The vaccines are divided into three categories. There's killed vaccine, modified live vaccine, and recombinant vaccine. And each one has their own risks and their own benefits as to why we like to give what we give. Now, the killed vaccines run the greater risk of causing harm to your pets in the cat family. And that's because cats are more sensitive than dogs to vaccinations, and every time you vaccinate a cat, you stand a risk of developing a sarcoma cancer at that injection site. Killed vaccines have the greatest risk of that because they use an adjuvant, a product in the vaccine that stimulates the immune system and can overstimulate the cat immune system. So I like to stay away from the killed vaccine. That leaves two other types, the modified live and the recombinant. Now, recombinant is the one where it's actually the virus you are putting in the vaccine, but they've done some gene splicing where a gene is taken out or a canary gene is put into it so that the virus isn't quite normal, so it can't replicate, but the body's immune system goes ahead and fights it off. That's the recombinant one, and that's the one that seems to have the lowest rate of sarcoma cancers. So that's what we use here. Now, there's the protocol of whether or not to put your cat on the leukemia vaccine or not to put your cat on the leukemia vaccine. And every time you give a shot, you stand a chance of that sarcoma. So if your cat is not exposed to the leukemia virus, which is deadly and transferred by other cats, then if your cat is not exposed, then I don't like to vaccinate, because the risk of getting the sarcoma far outweighs the risk of getting the leukemia virus. If your cat is exposed, if your cat's outdoors or exposed to an indoor-outdoor cat, then your risk is greater for that cat to get the virus. So I think it's worth it to get the vaccine. Now, the studies differ as far as how much risk each vaccine has. And what we know is the more your cat is vaccinated, the more they stand a chance of getting this sarcoma cancer. But for every vaccine, there's about a 1 in 1,000 to 1 in 10,000 chance of that happening. Honestly, since we've been using the recombinant in the past 5-6 years, I haven't seen one walk in my clinic. Not to say it hasn't happened, but before that, I would see them. I don't know how often, 1 or 2 a year, but I would see them. So I feel in my hands it's relatively safe for my limited experience. So the only vaccine that I give that is not recombinant is one called the feline AIDS virus vaccine, which is just like AIDS in humans, except it's transferred strictly through cat fights. Maybe slightly of a risk through the placenta from being pregnant, but strictly through cat fights. That one is adjuvanted, so that one does have a risk of sarcomas, but the only time I recommend that vaccine is if your cat is a male or fights heavily with outdoor stray cats, and then I think it's worth the risk. So that's in a nutshell of why we vaccinate and why vaccines are not all created equal. Thank you.